Welcome back to The Vine. So the month of May is known for lots of things, including Mental Health Awareness Month. And the stigma around mental health and treatment has long existed, even though this has somewhat started to change. Still, people hesitate to seek help or even talk about it. But with us today is some great advice from Baptist Health psychiatrist Dr. Anil Bachu. We're so glad that you're here with us this morning to talk about this. And tell me a little bit about depression and how people can recognize those signs and symptoms.
So depression, many people think that it's a phase of life, and sometimes they think it's just their weakness, or sometimes they think that they can come out of it with no additional help. However, it's very important to recognize the signs and symptoms of depression. The most common ones that people encounter is feelings of sadness throughout the day and not able to snap out of it, and changes in their sleep patterns and appetite. And one of the most important thing is anhedonia, what we call as, that is, lack of interest in doing things that they normally enjoy.
Just like lack of motivation, lack of excitement for things that you used to get excited about.
Yes, exactly. And feeling helpless and hopeless, feeling guilty for things that are really minor.
Right.
And sometimes, it comes to the point where they go into like a deep sense of sadness where they just want to not live anymore.
And a lot of times people are afraid to seek help for this. They do look at it as a weakness.
They do, yes.
Yeah, and people are afraid to also share with maybe their workplace that they are suffering from depression because they're afraid they won't look at me the same, they won't give me the same amount of, maybe I won't get that raise or that promotion because they think I can't handle it.
Yeah, that's very common. It happens in every workplace, I would say.
Right, and so it's so important that we talk about this. Okay, we talk about depression some, but also anxiety is something that I think we see more and more of. And how do we know the big difference between depression and anxiety?
So depression and anxiety, if you go into neurochemical standpoint, they both are on the same phase of serotonin depletion. However, the symptoms presenting are a little different. So anxiousness can be described as being nervous, like what I am right now.
You don't need to be nervous.
And then, or worried.
Right.
So anything could cause these, the experiences of what we have gone through before, and cause this similar memory triggers, and then people experience anxiety.
Right.
Most commonly, genetics, plays a big role in the anxiety.
So your genetics, it can be passed down from your parents, or and sometimes you can have depression and anxiety at the same time, right?
Yes, totally.
Yeah.
And the medications are approximately the same, and the treatment patterns are similar, but it's just a different way that people approach these symptoms.
Sometimes people don't seek help because they don't really know what they're feeling, or they do think it's just a phase, I'll get over this.
Yes.
But it's important to seek help.
Totally. Agreed.
Yeah, and how can they do that if they want to reach out to you or some of the other caregivers there?
So in the state of Arkansas, there is a great resources. It's called Arkansas Community Mental Health website, where you can go on and they find more resources. So Baptist Health do have outpatient clinic in North Little Rock, and there are other places like St. Vincent's and UAMS.
Right.
Are a great place for you all to go to. Also online, there is a supporting website for families and patients. It's called NAMI. It's National Alliance of Mental Health.
Right.
And where you can get a lot of resources for self-care and self-support.
And I feel like it's important for people to do that for themselves, but also if you know someone and they're not acting like themselves, or if someone in your family you think needs that support, reach out to them. Ask them if there's something that you can do to help them. I think that's important as well.
Agreed. Yeah. Family members should learn the symptoms and then how to treat and how to handle this.
Right. Thank you so much. Very important issue. I'm glad that you were here to share that with us today.
Oh, thank you.
Yeah. All right. Let's get a look at weather.